I have patients that have never worked out a day in their life. I press on this and it feels like I'm, taking the organs out, and it hurts, and it makes a huge difference in the overall balance of their spine. Hey, Dr. Steve Shoshany here. Today, I wanted to talk about active release technique. So if you know about ART, you're probably saying to yourself, oh wait, I heard about that from years ago. It was super popular maybe 10, 15 years ago with the athletic crowd, and it kind of faded away. But if you don't know about it, I'm here to tell you why you need to know about ART. So if I'm gonna be completely honest, I don't exactly enjoy doing ART because it's a lot of work on my thumbs, but we do what it takes, whatever it takes to get the patients better, and I found nothing works better when you integrate chiropractic care with soft tissue treatments like ART, whether it's a trigger point, a tight muscle, a fascial adhesion, whatever you want to call it. Once we integrate that, the treatment really steps up a notch. So what I'd really like to see is the popularity of ART to come back like it was 10 years ago, because what I've seen on social media, and I'm sure you watching this video, if you've gotten this far, you're looking for those satisfying cracks, pops, releases, and we definitely have our fair share of those, but the ART component is not a fad, it's not going away, and it's something that I in fact use every single day in my office with amazing results where patients are like, oh my God, I didn't even know that muscle existed. So when we address the muscular component along with the subluxation complex, we get tremendous results. So one of the questions I get asked often is this technique going to work right away? Yes and no. So when I mean works, what I'm looking for with patients is to get improved range of motion, decrease pain, and usually I can get that, at least 50% of that within one visit, but sometimes depending on how complicated your particular case is, you might need more visits, it might take time, and it might need some integration of chiropractic care, physiotherapy, exercises, and some other modalities like cold laser therapy or spinal decompression or flexion distraction to really address the underlying problem. So what is active release technique or ART? How does it work? So in layman's term, this is not for doctors, this is for the layman, you watching it out there. Basically what I'm doing is we're holding a muscle down or a muscle group or a muscle area, a fascial plane, and we're actively moving through a range of motion. So what we do is we shorten the muscle, hold that muscle down, pin it, and then going through an active motion until the motion gets easier. What we're trying to do is get length out of that muscle and it moves better. Sometimes the results are almost immediate depending on what muscle we're treating. Like let's say today, for instance, we had a lot of patients with chronic lower back pain. One of our go-to muscles is called the psoas or the iliopsoas muscle group. Generally what we do is we muscle test that flexor and we find it weak. We do a hold and we do a couple passes as we call it, and almost immediately the pain's gone and the muscle's stronger. So that's one of our go-to active release technique moves for the psoas or hip flexor for chronic lower back pain. So active release technique when done properly should not hurt, but if the area is in pain, it's going to be uncomfortable. It's not like a massage. It does require me holding that muscle down and you moving through a muscle that's shortened. So it's going to be uncomfortable, yes, but the end result is you'll get better range of motion, less pain, better flexibility, and better muscle function. So in the end, no pain, no gain sometimes is good with active release technique. I'm not here to hurt you. I'm here to get you moving better and functioning and back to doing what you love to do without pain, but sometimes no pain, no gain. Initial is okay. So can people that have other types of injuries get active release technique? Yes, it's a very safe move that we can do in anyone, whether they're children up into athletes, and there's usually no contraindications with getting active release technique therapy. Does it leave marks or bruising or cause pain after? Usually no. If done properly, it should not leave a bruise. It shouldn't be uncomfortable, but sometimes when we get length back to the muscle pattern changes differently, so generally I would recommend icing after. Can it be used as a standalone treatment, meaning just getting ART done? In my practice, I don't utilize it that way. I use it in conjunction with chiropractic adjustments, soft tissue treatment, or laser therapy or spinal decompression. So whatever it takes to get the patient better. If they need chiropractic care with ART or chiropractic care with Grasson technique, that's what we're gonna do to get the patient better. So question again that we get asked, how does it relate to surgery? Can it prevent you from getting a surgery? Well, in my practice, a lot of times patients come in and they want to avoid a surgery. So something like the active release technique or obviously chiropractic care can definitely be tried before surgery, and give it 30 days, 45 days. If you don't feel 50% better in that period of time, then maybe surgery is the only option, but it's always worth trying something non-surgical prior to committing to a surgical procedure. So cost, as of 2022, when we're shooting this video, the initial visit's around $250, follow-ups are around $150, and what we do is if you have a plan that I don't work with, we give you a super bill, you submit it to your carrier for direct reimbursement. So who created ART? I obviously didn't create it. A chiropractor named Dr. Leahy, he's in Colorado, developed this probably close to 30 years ago, and he's been teaching it worldwide, flying around the world, teaching chiropractors, physical therapists, and massage therapists. And like I said earlier, you know, I'd really like for it to see a resurgence and have more people use it, especially with what's going on TikTok out there. I'm not seeing enough of that. So stay tuned for our future videos, because we're going to be bringing in some more fitness influencers, and we're going to be doing some ART technique combined with chiropractic care. If you have any questions, comments, or concerns, reach out to us. I am very on top of my messages. I'll return your message right away, and we might get in here, and you might be on the next video. So if you have a problem out there in the New York City area and you're watching this, reach out to us. We might be able to help you, get you in. So until then, see you in the next video.